in menopausal women. Please, just wait. Okay, हम लोग start. Please start.
Good morning, dear judges and delegates. I am Dr. Nidhi Jain from Sri Balaji Institute of Medical Science, Raipur. My topic is Beyond Parity, the Enigma of UV Prolapse. UV prolapse is the descent of uterus and cervix, often with the vaginal wall, from their normal anatomical position due to weakness of pelvic support structure. It is most commonly associated with multiparity, advancing age, chronic pelvic floor weakness, menopause being the added factor. Prolapse in nulliparous women is rare and present as unique clinical entity. My aims are to study the clinical presentations of UV prolapse in different patient profiles, to emphasize the varied etiological factors contributed to pelvic organ prolapse, to discuss management consideration in typical and atypical cases. First case scenarios is 50-year-old menopausal female, short statures, nullipara, low BMI, and by occupation she is a factory worker, presents with marked descending per vaginum associated with discomfort and urinary symptoms. My likely diagnosis was UV prolapse associated with cystocele. Possible etiologies in this case scenarios are occupational strain, chronic increase in intra-abdominal pressure, connective tissue weakness, and poor nutritional status. Case scenario 2 includes 60-year-old female menopausal P3L3 with all full-term normal vaginal delivery at home, normal BMI, and homemaker by occupation, presents with something coming out per vaginum with urinary difficulty and pelvic heaviness. My likely diagnosis was UV prolapse with cystocele and rectocele. Possible etiologies in these scenarios are repeated vaginal birth, levator ani injury, menopause-induced estrogen deficiency, and age-related connective tissue degeneration. Line of managements include lifestyle and risk, weight control, avoid lifting weights, and treat cough, constipation, nutrition status, and stop smoking. Conservative managements include pessary, vaginal estrogen, PFNT, and physiotherapy. Medical management includes UTI treatment, atrophic vaginitis, and pain relief. Surgical management according to scenarios. Regular follow up is necessary for pelvic floor muscle training is important. UV prolapse in nulliparous women is uncommon yet significant. Early identification of risk factor enables timely intervention and management. Thank you.
Do you think this is grade 3, grade 4 UV prolapse any role in the conservative management?
Yes, sir.
Conservative management in grade 3, grade 4 UV prolapse is
Sir,
there?
no, sir. But like in conservative management, sir, in pelvic floor muscle training, we can reduce symptoms or
What's
like in more than 60 years female, where we cannot do surgeries, we can at least reduce the symptoms of prolapse.
Post-operatively,
Yeah.
also some do's and
Post
don'ts
operative,
need
yes,
to be
ma'am.
followed.
Yes, ma'am.
So, what do you think could be the cause in the first case?
Ma'am, it can be as she is factory worker, it can be due to occupational strain, and also as ma'am, maybe she has a complaint of
Constip-
chronic cough or like constipation. So,
That is one very
chronic
important
increase in
factor.
intra-abdominal pressure can cause prolapse.
So,
congenital weakness of the pelvic floor muscles and the ligaments?
Yes,
So
sir.
that is one of the major cause.
Yes, sir.
Yeah.
and under examination, did you see it was only cystocele, or was there a uterine descent as well?
No, ma'am, only sisters.
Only
We are
cystocele.
saying that.
वही थोड़ा सा अजीब लग रहा है कि so what would be your differential diagnosis, because it's quite glistening in the picture, it's quite glistening, so what do you think would be the differential diagnosis in such a anterior vaginal wall mass?
Ma'am, it can be inversion of foot. Yes, ma'am. Yes, ma'am. It can be system.
What is the name of that cyst?
Garden cyst.
Bartholin.
No, ma'am. Garden.
Gartner's disease. Take it. You have to keep that in mind, because many a times those cysts present
Can
as
be.
cystocele,
Yes,
because सिर्फ cystocele क्यों होगा
yes,
in a nulliparous lady? Okay. That I
UV
asked her, she told there was no uterine descent. I asked her just now.
Ma'am, I have written UV
Oh,
prolapse with cystocele.
oh, but when I asked, you said no, there was no uterine descent.
Yes, ma'am.
I
Okay,
have
okay.
I have one important announcement. All participants after this presentation, please reach Chitrakoot Hall because in within half an hour we'll declare the results in Chitrakoot Hall so that they know, who are the winners. Yeah. So they know the prizes. Yeah. At least the winners should. So after you're finished, you come to Chitrakoot Hall within by 10 before 10. Yeah.
So, Dr. Rena, are you ready? So, good morning, Jyoti.